Memphis Vascular Center specializes in the minimally invasive treatment of diseases and health conditions. And they're sponsoring our segment about their minimally invasive treatment of uterine fibroids here on Live at 9. Joining us in the studio here is Dr. Dale Hansen from Memphis Vascular Center. Good morning. Thanks for coming in.
Good morning. Thank you for having me.
Yes. Okay. So what are fibroids?
So fibroids are a benign muscular tumor in the uterus, and what that means is that they are an abnormal growth that happens in the uterus, but they're benign, so they're not like a cancer or anything like that that's harmful or going to result in mortality in the long term. That doesn't mean that they're a friendly mass to have, though. See on the graphic here, they can grow, those little white areas are the fibroids growing in the uterus. They can grow in multiple different areas in the uterus.
And how common are fibroids?
Extremely common. Up to 80% of women, particularly African-American women, will develop fibroids at some time in their life. The sweet spot for age is usually between the ages of 45 and 50, although it can spread out. You have people as young as in their 20s, and even postmenopausal may still have some symptoms from their fibroids.
Okay, and why African-American women? What is it that's causing African-American women to be most prevalent?
Sure. So there are several different reasons to have fibroids, several different things that kind of feed the fibroids. Genetics is one of the big conditions. So if your mother had fibroids or aunts had fibroids, you're more likely to have them, and African Americans just have the genetics to have those. They're also hormonally regulated, so any woman can have them, but it is more common in African Americans.
Okay, let's talk treatments because I know our people want solutions. Talk to me about interventional radiology. What is that?
Yeah, so first I'll say the most commonly done treatment for fibroids is a hysterectomy, where a gynecologist goes in and takes out the whole uterus. And that works very well for the treatment of fibroids, and it's been done for years. The problem with a hysterectomy is it's a big surgery, usually about 6 weeks of recovery time afterwards, and for some women that's just not really an option. So interventional radiology is a specialty of radiology, and what we specialize in is minimally invasive treatments using some kind of imaging guidance, so either ultrasound, CT, X-ray, things like that to guide what we're doing. Specifically for fibroids, the treatment we offer is called a uterine fibroid embolization. And what that involves is making a very tiny incision in the groin, usually about less than half an inch, and then inserting a very small tube into the arteries that supply the uterus with blood. And once we have that tube in there, we inject these little beads, which are, you can imagine it's just right after Christmas, you have snow globes, you shake up a snow globe, you see the little snow falling down. That's basically what these beads look like. So very small beads that we inject into those arteries. And what those do is they take away the fibroid's blood supply. The fibroids need a lot of blood to survive.
So kind of like blocking it off.
Exactly, exactly. And so what will happen is that those fibroids will then die over time after we take away their blood supply. The recovery time from this, like I said, for hysterectomy is usually about 6 weeks. This is 7 to 10 days.
Very quickly, if you could explain some of the symptoms for anyone who doesn't know that they actually might have them.
Yeah, and a lot of women have fibroids, never know they have them, never have a problem, and there's really no issue with that. But for the women that do have problems, they can be pretty severe. The biggest one is heavy bleeding during periods. It can be anything from something that's just a nuisance to be bad enough that people are having to get blood transfusions because of it and end up in the hospital as a result. Other symptoms, bad cramping, that can even be, a lot of women have to miss work when they're on their periods because their cramping is so bad. And then they can do other things. They can press on the bladder, you have to pee all the time, press on the colon, you get constipated. And then some people can feel them and they stick out of their belly, or you get just kind of uncomfortable because
like a little pooch.
Exactly, exactly. So I had one woman tell me there's her alien coming out.
The alien. Oh, well, thank you so much for explaining what this is, letting women know what to look out for, and then also the treatment that you have that's minimally invasive.
Of course.
Thank you so much, Dr. Dale Hansen. Thanks to Memphis Vascular Center for this segment.